Hello, my name is Josh Anderson, and this is a video demonstration of a respiratory assessment for a patient who presents with a cough. To begin, I would enter the room and introduce myself to the patient while washing my hands. Hello, my name is Josh. I'm going to be your nurse today. Verify the patient's first and last name and birthday. After this, I would ask what brings the patient in today. So what brings you into the doctor today? Patient states they've had a cough for the past 5 days while coughing up some green guck with their cough. I would note that the patient has a productive cough with green sputum. Is there any other? So along with the cough, how long has this been going on for? Patient states that it's been going on for the past 5 days. I'd ask if any other symptoms the patient's having. Is there any other symptoms you've had to go along with your cough today? Patient states they have had a sore throat and a fever of 101 degrees. I would then ask the patient about personal and family history for respiratory disease. Do you or any of your family members have any history of respiratory disease? Patient denies any personal or family history of respiratory disease. Have you ever smoked either tobacco or any other smoke products? Patient denies any history of smoking. Okay, so I'm just going to take a look here and take a look at her throat and take a listen here. I would begin by examining the patient's throat, having them open their mouth, stick out their tongue and say ah. I would then use a pen light to get a good visual of the throat. Noticing that the throat is reddened on the inside. I would also take a look at the patient's ears using an otoscope, ensuring that doesn't appear to be any fluid behind the eardrums. I would then take and do a listen to the patient's lungs. I would have the patient lean forward. So I'm just going to have you lean forward here and take a couple of deep breaths for me. So while listening to the patient's lungs, I would have them take a deep breath, then listen to each lobe of the lung. I would note that there is a ronchi sound in bilateral in the top lobes of the lungs. And that would conclude my respiratory assessment for a patient that presents with a cough.